Hi, everyone. All right, well, we're just gonna jump right in. So this is optimizing health. I chose this one as the first course in the series because it covers really all the systems. We'll go into the objectives of the course, but it's covering the holistic wheel of health. And so when we get into the next courses, going over the specific conditions like adrenal fatigue and thyroid health, it all comes back to this presentation with the various ways to decrease inflammation and just optimize your health. Okay. A lot of times when I was still seeing patients, while we were digging for the root cause of the condition, it takes a little bit of time with lab work and imaging. We would start with these key, simple, but really effective changes. And I would notice that their conditions would start to improve, regardless of whether we found what the disease state was. So that's why I like to start with this. All right, so the obligatory disclaimer, not so much in this course, but in the latter courses, I will be talking about various medications and vitamins. And even with diet changes, even though a lot of them seem natural, they can impact what treatments you're already on. So I always have to say, discuss any changes you want to make with your provider. Okay, moving on. So this is me. I am Dr. Christina Greengard, but really I just go by Christina. You can just refer to me as that. I am a medical doctor. I did have a private practice, and then my son was having some challenges, so I shut down my private practice and moved that to more telehealth. So that's mindful medicine. And then Mindful Medicine Academy is where I teach courses like this. So I do a lot of my teaching online usually, and I do it for corporations and organizations. So we'll get into that later. But my goal here really is to empower everyone to know about their own healthcare so that they can go to their providers with the educated questions and asking for the right lab tests and maybe treatment changes. Okay, great. All right, so this is the series. So today is April 21st. We're going over optimizing health. And if you're interested in the other courses, adrenal fatigue and thyroid health, we're going to talk a little bit about today, as well as sleep a little bit. And then understanding mental health will be the last one. Okay, so this is the wheel of health. We'll talk about each one of these today and understanding how they impact your health negatively and positively, and some changes that you can make to improve your health. Okay, I want to start with diet because even though, and I'll just go back to the slide, even though all of these are really important, I really feel like diet can make the biggest impact on your health. So this is what we're going to cover. Prioritizing nutrient-rich foods and what those foods are, balancing blood sugar so you're not having blood sugar spikes, specific diets. One of the questions I get most commonly is, what diet should I be on? What's the best diet? And there's just no way to answer that. And I'll get into that when we go over specific diets. And then what foods and drinks to avoid just to decrease inflammation in the body, hydration tips, and then how to support your gut health. All right, another question I get is, what are the best foods for me to be eating? What are like the ones that pack the most punch? And it really just depends on what your goal is. Are you trying to increase your antioxidants? Then that would be berries, green tea. Everyone loves when I say dark chocolate. And then if you're trying to increase your magnesium, these are the foods that you can eat. B vitamins, this is big for people who are vegetarian or vegan, alternative ways to get B vitamins in because a lot of it is found in meat. And then omega-3 fatty acids, this helps to decrease inflammation in the body and then also helps with your neurological health. Vitamin D, so there are foods that contain vitamin D, but really the best way to get vitamin D is through sun exposure. I always recommend going out first thing in the morning.
She's a sun worshiper.
I always recommend going out first thing in the morning for multiple reasons. One, so you don't so it's not as hot. And, so you're not getting sunburn. And then also, to adjust your circadian rhythm. It's really good for your adrenal glands and your cortisol production to go out first thing in the morning as soon as you wake up and get that sunlight hitting your face. And then being out there for 5 to 10 minutes until your skin starts to feel a little warm and is getting a little pink, but it's not red. That's when you have absorbed the most vitamin D that you'll get for the day from the sun. Okay, balancing blood sugar. Oh, I also need to mention, please stop me at any point if you have questions, because I tend to go a little bit fast and there's a lot of information to cover. Okay, balancing your blood sugar. So having blood sugar spikes it does a number of things to our body. It's really disrupting your hormones if you're not balancing your blood sugar, especially cortisol. So eating regularly to avoid those sugar spikes and making sure that you're eating the right types of carbohydrates. So everyone thinks carbohydrates are bad, right? But they're not. Complex carbohydrates are good. Our body needs those. That's the sugar that we really run on. And that would be these. So whole grains, legumes, vegetables, fruits, apples with the skin. And then avoiding processed sugars and simple carbohydrates. So these are the carbs that we don't want. So these are things that are going to give us those huge blood sugar spikes. Can you see? And making sure to eat regularly. So every 3 to 4 hours, if you can. A great way to do this is to have just a bag of nuts and seeds, if you're not allergic, if that works for your diet, in your purse or your bag at all times, and you can just snack on that throughout the day.
Yeah, I think tips like that are gonna be really helpful. I think the hardest thing about like eating healthy is the time that it takes
Yes.
to eat healthy. And we are always running around trying to take care of our kids and go to appointment after appointment. So we go to like McDonald's or we go to fast food just because it's the easiest. So I love tricks like that. Like
Absolutely.
keep seeds, keep something in your
something
bag with
there.
you.
Yeah.
Because I don't do that enough.
Yeah.
Yeah.
And we make the poorest decisions when we're really hungry and our blood
Mhm.
sugar is low.
Yeah.
Because our body's starving. We're like, oh, I see the drive-through right there. I'm just gonna go there.
Yeah.
All right, supporting gut health. So a lot of our neurotransmitters, people aren't aware of this, our neurotransmitters and our immune system is found in the gut. There are certain bacteria that live in our intestines that promote the growth of our certain immune bodies. So just to impact our immune health, we want to keep the gut healthy. And there are a number of ways to do this. One of the biggest ways is to, if there is anything going on in the gut, to clear that up, right? And a really popular or a big term that's happening right now is something called leaky gut. And what leaky gut is, we'll get into this a little bit later too, but it basically is so much inflammation within the intestines that your nutrients are leaking through into the bloodstream. You're not absorbing them in the way that you should be. And so there's just a lot of inflammation happening. Now, by including probiotic foods, so these help promote the growth of the bacteria, the healthy bacteria, and then prebiotic foods, so these feed the bacteria. These will help to maintain a good, what we call microbiome. I could spend 2 hours talking about just microbiome, but there are certain bacteria that we want a lot of in the gut, and there are some that we don't. And a big one is candida. Okay, we hear the word candida and we think, oh, that's bad. We shouldn't have any candida in our gut, but that's not true. We should have a little bit. We just don't want it to be overgrown. So that goes for all the different bacteria, even the.
Is that a type of bacteria?
Well, candida is actually yeast.
Okay.
But yeah, even something like lactobacillus is something we would normally consider beneficial. If you have an overgrowth of it, it's no longer beneficial. So eating foods like this are just helping to maintain a good balance, including the fiber-rich foods. Fiber-rich foods are good for the bacteria, but what they're really good for is decreasing the inflammation and having good liver health. Fiber is really good at regulating cholesterol levels, and when we have good cholesterol levels, our hormone levels are balanced. So another thing another condition that is increasing right now is something called diverticulitis. There's inflammation of the intestines, and that's coming because of the lack of fiber in our foods. When our intestines aren't being cleaned through properly with the fiber-rich foods, then things stay in there, and it's not good for our intestines. So, also what's increasing in prevalence right now is colon cancer in younger people. And they're requesting Cologuard or colonoscopies done earlier than how they were previously because of the increase in the incidence of this, because of the lack of fiber in our foods. So fiber, I just can't speak highly of it enough.
Can I ask you a question?
Yeah.
Because I hate yogurt. But I've started to drink kombucha. Like, how do you know what brands are actually good? Because they're not really regulated, right? So how do you look for ones that you know, like, will actually give you those live bacteria that are good for your stomach?
Sure. So with any food product, there's going to be some that are better than others.
Yeah.
The only thing I can really say to that is to make sure it's effective, you want to make sure that before you open the top, it's properly sealed. And then when you do open it, you're hearing a hissing,
Yeah.
right? So you're hearing almost like a carbonation.
Yeah.
And that would mean that there are live cultures in the kombucha.
Okay.
Not to mention the fact that when you open it and it smells a little like feet, then it's the live culture.
I got it, drinking the right one.
Yeah.
Will we be getting slides after this or no?
Yeah, I'm happy to provide those.
Okay, I just didn't wanna like be like.
No, yeah.
Okay, thank you.
How will I know if a question pops up? Well, something.
I'll let you know.
Okay.
Yeah, I got you.
All right, this is a pretty heavy slide here. I just wanted to put it all on one slide and get it over with. This is the food and drinks that we should be avoiding because these are the ones that create the most inflammation in the body. And a lot of them are known carcinogens, which means that they can cause cancer in the body. Processed and packaged foods are just full of stuff we don't want. So that would be anything that's like instant noodles, ramen, that's a perfect example. Something that is kept on the shelves and can live there for years and be fine. I put refined and complex carbohydrates here only because I want it to be limited in the diet. Especially the refined carbs, which would be the simple carbohydrates like donuts and pastries, that sort of thing. Sugary foods and beverages, that's just an easy one. That's the stuff that I say can be easily eliminated, but it's not so easy. But these are, the desserts, soda, candy, that sort of thing. Fried foods, I think we all know that. Those aren't great for us. Artificial sweeteners. So I get this question a lot, and people ask me like, well, why can't I have my Diet Coke? And even though it doesn't have calories, the artificial sweetener in there is a known carcinogen, so aspartame. And there are alternatives. So I didn't put them here, but like erythritol, monk fruit, stevia, those would be better alternatives to having some of the aspartame, sucralose, that sort of thing. It's better for your gut health as well, because aspartame kills off some beneficial bacteria in our guts.
How do you spell that one that starts with an A?
Aspartame?
No, the whatever.
Oh, erythritol is ERYTHITOL. Erythritol.
That was awesome. I know. I was like, yeah, well, I would.
Well, I'm glad I asked because
Yeah.
thought I started with A.
Yeah,
So,
perfect.
thank you.
Processed meats, the main one for this is because a lot of them have nitrates in them. They add nitrates as a preservative, and that is a known carcinogen as well. Alcohol and caffeine. Alcohol strains the liver, it disrupts your sleep, and then too much caffeine. This is not, just kidding. It can lead to dehydration and affects your heart. This is a great guide. So every year, this list is put out. 2025 isn't out yet, but the Environmental Working Group puts out a list of the Dirty Dozen and the Clean 15. And this is referring to what's best to buy organic versus non-organic. The dirty dozen are the foods that contain the most pesticides for that year. So if you're gonna buy anything organic, it should be the dirty dozen. But organic can be a little bit more costly, so if you're trying to make choices as to what's okay to buy non-organic, then the Clean 15 would be those. And it's usually the foods that have a thick skin that you're not consuming, like avocados, melons. The pesticides that are on those usually aren't getting to the foods as much as something you eat the skin of, like strawberries or peaches and that sort of thing.
Is there a good way to clean the dirty dozen well enough to consume, or is it like they're just really ingrained in the inside even of like the fruit?
They are inside of it.
Okay. You're like, no.
I would not suggest it.
Okay.
It's almost better, when you're at a restaurant and they ask, do you want, you order breakfast and they say, do you want a side of potatoes or do you want a side of fruit? And say, well, what's in the fruit? And they say strawberries. And you're like, oh, that seems healthier than the potatoes. No, it's not. Because it's a dirty dozen. I mean, strawberries is number one and almost every year is number one. So, I always recommend don't eat strawberries from the restaurant.
And what's the risk of the pesticides?
Pesticides, yeah, it's just, and we'll get into toxins a little bit later, but basically, pesticides are something called an endocrine disrupting chemical, EDC. So it messes up your hormones.
Okay,
That's not good.
that makes sense.
All right, I am not affiliated with this application. I just love it and wanted to share it. This is a free app you can have on your phone. It's called Yuka. And you can use it when you're grocery shopping and you can scan foods and it'll give the foods a rating out of 100. So as you can see, I have a couple examples here. You can either scan the product or you can search. So I searched crackers to see what would be the best type of cracker. As you can see here, Ritz is so bad, it's a 0 out of 100. Honestly, I've never seen
Oh
a
my
rating
gosh.
on YouTube, of course. And then it gives the reasons why. So the additives, the sodium.
Typically engineered that way.
And then it showed me, lower on the list that Mary's Gone crackers were good. I actually haven't seen these in the store before, but anytime that you scan something, it will give it a rating. So whenever I'm grocery shopping, I'm using the Yuka app. This
Wow.
last one, if you can see it here, you do have to pay for this option. I believe it's like $19 a year, but you can search, like one day I had a patient asking me for what's the best non-dairy creamer. And so that's what I searched here. And it showed me the ones that are bad versus what is the alternative. So like down here, you can see this one, the hazelnut Chobani is poor, but the almond creamer from Khalifa Farms is good.
Oh, that's so great.
And so you know what to switch it with. I love this app.
I love the Chobani ones.
I know, I'm sorry. I'm always the bearer of bad news. I'm so sorry. Let's blame you for that.
Hope to do research later.
All right, again, one of these really simple tips, I think we all know we need to drink a lot of water, but I have to speak about it because it's, even in Arizona when it's so hot, it's just hard to get enough water. And the amount that we need, I always say on average about 100 ounces, but really it's your body weight, half of that in ounces. All right, so if your body weight is 200 pounds, then 100 ounces per day is your goal. At least, that is the bottom, that is your minimum.
What's in this?
That looks like maybe 24.
Oh, dang.
And then, of course, increasing the electrolytes in your water will help you absorb that water better. I can talk about water for an hour, but I'm just gonna say this. Okay, so what's the best type of water? So people say, well, I drink the filtered one from my fridge, or I have the 5 gallon that is the dispensed version, like the Sparklets or whatever. I would say the best type to use if you don't have your own filtration system, like a Berkey at home, then it would be reverse osmosis. However, reverse osmosis takes out everything. It takes out even the good minerals. So when you're drinking reverse osmosis and you're not adding any electrolytes, it is going right through you. Your body is not absorbing that at all. So you have to add electrolytes back into it. And the simplest way to do that, what I do is by my RO little spout, I have my Celtic salt sitting right next to it, and I just take a little sprinkle of it and put it in my water, and I don't taste it. It doesn't taste salty or anything. So you could use Celtic salt, you could do any of these options here, like electrolyte packets or adding citrus to it. There are trace mineral
Just the
drops.
only way I drink water, I hate water, and if I put electrolyte packets in it, I
Perfect.
can down some water.
Yeah, great, great. You'll absorb that so much better. And some people will do like on Sunday night for the week, they'll prepare a giant jug of water where they cut up a bunch of fruits or citrus and then just dispense out of that for the week too. That's an option.
We have like a crazy RO system at home, and I was like, this is so good for us. No, okay. I gotta figure out how to add electrolytes back in.
Just make sure you're adding electrolytes.
Yeah, that's so funny.
Good to know.
Yeah, good to know.
All right, so coming back to the great question, what is the best diet to be on? There's no way for me to answer that because it depends on what your goals are or if there is something you're trying to prevent. So if your family has a genetic predisposition to high cholesterol or heart disease, then the best one for you would be the Mediterranean diet. If you are if your family has a predisposition to diabetes, or if you are pre-diabetic on lab work, the best one for you would be the anti-inflammatory diet. If you are, well, there's some controversy with this right now in the literature, but traditionally it was stated that if you were trying to prevent cancer and you were trying to have a very alkaline or basic blood in your body to avoid cancer growth, then the plant-based diet was best for you, which would be vegetarian or vegan. All right, so I know that's a lot, and it's always easier said than done when we're trying to change our diet, but here are just some little tips that might help you if you plan ahead. So preparing meals, and I know this is hard because we're all caring for people. What I like to do is I find one day and time that I have free to meal prep, and I spend a couple hours doing that, and it just saves me from making poor choices later in the week. So if you are able to devote an hour or two to meal prepping, even if it's just snacks for the family to maybe keep in the car, then that will help, and it'll benefit the whole family, not just you. Practicing mindful eating. So this is a big one. I know, again, this is hard when you're caring for people, but if you are able to eat without distraction, so without a TV on, without looking at your phone, without working while you're eating, you are going to digest your food better. When we're busy and our mind is going a million miles an hour and we're working and then we're just taking bites and we're working, you're just not absorbing that food. Your body's not taking in those nutrients as well as it would if you were mindfully eating. So thinking about your food, really enjoying it, and it will help you enjoy the food as well and really taste it. When you're working, you're not tasting it, you're just getting it in. So you're not having blood sugar spike or crash, excuse me. And then start small. So just one step at a time so you don't feel overwhelmed. If that's just water for the next month, then great. You increase your water. That's awesome. And then maybe the next month is adding nuts and seeds to your purse so that you don't make poor decisions while you're driving around. All right. This is all easier said than done.
Are we stressed? Hold on. Hold on a second.
Yes. I'm just gonna say, and maybe some of it helps. But I know, again, easier said than done. So, of course, we know the benefits of reducing our stress would be to lower anxiety, and it lowers our stress hormone, which is cortisol, and it improves our focus and our emotional regulation, and just overall boosts our well-being and immune function. I don't know about you all, but I've noticed that if I have a deadline for something, or I've just been feeling really stressed, and then that event's over, I always get sick. It's because that stress shut down my immune system, and I was in fight or flight that whole time, and now my body's finally resting, and I have no immune system. It's because of this. So some effective techniques, journaling, of course. If you're somebody who enjoys writing, you don't even have to do it, pen and paper. You can type it on your computer and just don't even read through it. Just type away and just let it go. And then you can delete that page if you want. You don't have to keep them. Nobody's reading them, hopefully. And visualization is great if just sitting here and just thinking about maybe the beach or the mountains or whatever's really calming for you. Deep breathing, we'll get into some breathing techniques here in a second. Mindfulness meditation, which really just is, well, obviously I love talking about mindfulness. My practice is called mindful medicine. Mindfulness really just means we're focusing on the present moment. We're not focused on the event I have in a week that's stressing me out. It's just right now what I'm doing, being here with you lovely people. Massage therapy, of course, if we could, as much as we could. Progressive muscle relaxation is a great one. Basically what this is you're just tensing up all of the muscles in your body for 5 to 10 seconds, as much as you can, and then releasing them, and then sitting with that release. This is a great thing to do before bed to calm down your nervous system. All right, my favorite breathing exercises. And I'll be sending these slides to you so you have this information. And I don't know if you want to try to breathe with me. But basically diaphragmatic belly breathing is just sitting and feeling your belly. And you're just making sure that when you take in a breath, it's not from your chest, it's from your belly. So just breathing in through your belly. It's a great, easy one to do. Box breathing is probably my favorite. This one is inhaling through your nose for a count of 4. Inhaling through your nose for a count of 4, holding it for 4, exhaling for 4, and then holding that again for 4, and repeating that 4 times. Perfect. And then alternate nostril breathing is a great one as well. That's basically you're just alternating which nostril the breath is coming in and out of, and you'll do that by holding the nostril with your forefinger and your pinky. Everybody prefers a different type of breath. It's really just about what works for you. I do box breathing a lot when I'm driving and somebody slams on their brakes and you almost get in a car accident and then you need to calm down afterwards. The box breathing is my favorite. Another one I didn't put on here is straw breathing. That's a really easy one to do if you have a straw that's got a bigger diameter, not a very small one. But basically just breathing in and out through the straw and not through your nostrils. It helps you to slow down your breath. So normally when we're anxious, we breathe faster, sort of hyperventilating. Using the straw forces us to really slow that breath down. All right, we're going to get into balanced hormones next. This is just 5 reasons as to why balanced hormones are important, but really it's for overall health. I can't stress it enough. And the chronic stress that we're all facing messes all of our hormones up. And I'll get into that. So we're going to talk about some of the most common hormone imbalances, but please know that I'm just briefly covering the courses that are coming up later in this series. Will go into them in much more detail. So let's talk about thyroid. So we have hypothyroidism, which is low thyroid hormones, and we have hyperthyroidism, which is high thyroid hormones. With low thyroid hormones, everything slows down. Our thyroid hormones are responsible for our energy and our metabolism. So when we don't have enough, everything slows down. These are the symptoms I commonly see when somebody comes to me and they say, I've gained this weight, I can't get it off, I'm always cold, I'm so constipated. I'm like, okay, let's check your thyroid. Those are the most common symptoms here. Some causes for that, an autoimmune condition called Hashimoto's thyroiditis is a common cause for this, and it's unfortunately, it's pretty common, Hashimoto's is. And then having an iodine deficiency. So with the movement into eating more pink salt, and we've moved away from table salt, we're not getting as much iodine as we used to. Because there's no iodine in pink salt. So that's been another cause for this.
Is regular salt better than pink salt? Okay.
I actually take an iodine supplement.
Do
for
you?
this reason.
Yeah. Yeah, we could get iodine through many other ways in our foods.
Okay, okay.
Chronic stress. So anytime that we have too much cortisol and it's affecting our adrenal glands, then it's affecting our thyroid as well. Of course, thyroid surgery, if you've had part of your thyroid or the entire thyroid removed, then you're going to be hypothyroid, and some medications can do this as well. The labs that you want to ask for from your providers is TSH, free T3, free T4, reverse T3, and thyroid antibodies. Now, the reason I pause there is because most providers are only ordering TSH and maybe total T4. They're not ordering these other ones unless you're going to a functional medicine practitioner or a naturopathic physician, because they just don't. They don't see a need to. But having all of these gives you a clearer picture as to what's going on in the thyroid. So you really need to advocate for yourself to order all of them. The treatments usually are selenium, iodine only if deficient, because too much iodine can cause other issues, zinc and L-tyrosine, and then the medications most commonly prescribed are levothyroxine and natural desiccated thyroid. Now, again, just a disclaimer, you need to talk to your providers if you're thinking about adding any of this on. Selenium can also be harmful with certain conditions, so these are just things to bring up to your providers. Okay, now hyperthyroidism. Now, this is a lot less common. I don't see this very often in practice, but this is somebody who's experiencing weight loss. They have a lot of, as if they had too much coffee, like jitters, tremors, their heart's palpitating. It's literally like this person. They just feel like they're crawling out of their skin. The autoimmune condition for this is Graves' disease, and then thyroid nodules can cause this, and excess iodine intake. Same labs, except reverse T3 is not considered here. And the treatments are supplements of bugleweed and lemon balm, and medications would be anti-thyroid drugs or beta blockers, which help with the heart symptoms. So again, May 5th is the course if you want more information about that. All right, now the stress hormone. So cortisol. Cortisol is our stress hormone, and I know that we talk a lot about cortisol being bad. It's actually good. We do want some cortisol. This is what keeps us awake. This is, it works inversely with melatonin. So melatonin brings us down, it gets us to sleep. Cortisol is what wakes us up. A lot of times when we have too much cortisol during the day, not just in the morning when it should be, then it depletes our reserves. Our adrenal glands are what create cortisol. So when we've been making too much cortisol, then eventually the adrenal glands just can't make any more. And that's when you get adrenal fatigue. So that's this second one. So it always starts with cortisol dominance. And then if it's prolonged and we're not reducing that stress, it turns into adrenal fatigue. So first we start really hyped with cortisol. Cortisol is also what gives us that fight or flight feeling. So you're going to feel like that. You're going to have anxiety. You're not going to be able to sleep. You will probably have weight gain, especially around the belly, and sugar cravings. Then it's prolonged too much, and then it comes down to fatigue, low blood pressure, because your body doesn't have enough to give you that energy. So as you can see, you start off high, and then now you're depleted.
Okay. So I just have a quick question, because like we know that like a lot of caregivers have PTSD, right? And a lot of that results in the adrenal fatigue, right? Is that right?
Sure.
Okay.
Yeah.
Okay. I just wanted to,
Yeah, totally. Yeah.
okay.
I'm all about that brain fog.
That's a big one, the brain fog.
I'm like, why can't I remember anything?
Yeah, I hear you.
Right.
The best way to test your cortisol levels So let me back up. Cortisol is released cyclically, which means in the morning, it should be the highest because it's what wakes you up. And it should be the lowest in the evening, right before your bedtime. So you need to check it 4 times throughout the day. Okay, so a lot of times providers are ordering cortisol just in the morning or just at a random time during the day, and that tells us nothing. It doesn't show us what the curve is. So, and it's really tested best in the saliva. So usually the test includes a little cup that you spit into at 4 times during the day, and then you send that in. And that tells us what the curve is. Is your curve normal, where it's high and then it goes down, or is it backwards, where it's low in the morning, where you feel like you need to drink 5 cups of coffee to stay awake, and then maybe it's still low in the evening, or maybe it's high in the evening, and that's when you have insomnia and anxiety, and you can't go to sleep. So we need to see that image, those different levels.
What would you do with that information?
I don't even know how to answer that question. Well, we would start by giving you, so if your cortisol is too low in the morning, then I would give you some herbs or medications to raise it up first thing in the morning.
Okay.
And then if it's too high at night, I'd give herbs or medications to lower it at night.
Okay.
So that your body is retrained in the appropriate curve.
Okay. Yeah.
That would be amazing. I have insomnia like crazy, so yeah.
Might need to check your cortisol.
Just hit tone.
So April 28th is the adrenal fatigue
Oh.
course, if you would like more information on that. All right, now female hormones, again, another one that is disrupted with stress. We have estrogen dominance, which would be more of heavy periods, bloating, mood swings, and breast tenderness. The causes for that are excess body fat, especially around the midsection, that increases the production of estrogen, and xenoestrogen exposure, which is the toxins that we'll get into in a little bit, and then liver dysfunction, because liver is what helps to produce our hormones. The labs that you want to ask for are estradiol, which is a type of estrogen. Estrone is another type. Progesterone is a big one, and these can be done in saliva or a blood test. And these are the supplements and medications. I can go into this in so much more detail about every single line on this page, but ask your provider about these. Estrogen deficiency, so this is more like what we think of with menopause, right? So night sweats, hot flashes, vaginal dryness, mood changes. These are things that don't just happen around age 45 anymore. These are happening much earlier because of our cortisol issues and chronic stress. So again, here are the labs to ask for: estradiol, FSH, and LH. And the supplements for this would be types of herbs called phytoestrogens. And then medications, of course, would be like estrogen hormone replacement therapies.
So like the stress stuff can throw you into premenopausal
Absolutely.
a lot
I've been
earlier.
treating menopause in 40-year-olds.
Wow.
That supplement, does that have estrogen in it?
The red clover and soy,
Yeah.
they have components in it that mimic estrogen. They don't have estrogen specifically.
Do they like lead to blood clotting potentially or not?
Some herbs can, it just
Okay.
depends, it depends which one it is. But usually not. Not as much as a synthetic estrogen hormone replacement therapy would.
Okay.
The more natural forms of it, of estrogen replacement therapy, do not.
Cause I have a PFO, so that's one thing I'm like, I don't know what to do about going through menopause, yeah.
So I have more courses on my website, and I have one about this.
Okay,
If you want more information, this just isn't in our holistic health series.
sure.
But let's talk.
I was just curious.
Yeah. All right, another one that is affected in almost all of my patients who are dealing with chronic stress is progesterone. The biggest one that I see is progesterone deficiency. I'll go back to dominance in a second, but it is the trouble sleeping. People who have trouble sleeping, especially those that can't fall asleep because their mind is racing. If I check their progesterone on labs, it's almost non-existent. And then taking a natural form, which is, it's taken from horses, it's an equine progesterone. You can actually get it at the pharmacy. That brand is called Prometrium, but the generic form is oral micronized progesterone. Taking a little bit of that before bed will knock you out. If your levels are low, you don't want to take it if they're high, so you have to check your levels first. Okay, so progesterone dominance, that's where, think of pregnancy, how you felt if you have been pregnant, that's how you'll feel. You will have mood swings, low libido, fatigue, usually breast tenderness comes along with this. And so, one thing also, if you're gonna ask your provider to check progesterone, you have to ask it mid-luteal phase. So what that means is day one is the day you start bleeding if you are still having a menstrual cycle. Mid-luteal phase would be day 19, 20, or 21. That's when progesterone should be at its highest. So it has to be checked then, because if it's showing low during that time, then it's really low. Okay, so that's a key. If your provider's asking you to check for progesterone and doesn't care what day of your cycle you're on, then that's an issue. Okay, and so the treatments for that would be to adjust your hormone therapy if you're on it. And because it's very rare to have progesterone dominance on your own, if you're not taking something that's making you have high progesterone. And then for progesterone deficiency, the good supplements for that would be Vitex and then just magnesium. And then medications would be the one I discussed, or progesterone cream. Okay, female hormones, the testosterone, excuse me, testosterone dominance versus deficiency. Testosterone dominance I'm seeing more specifically in people with PCOS. And the symptoms are acne, hair growth on the face or the chest, irregular periods. A deepened voice is, I mean, you have to be on testosterone therapy for that to happen. So that's not very common. And then the labs to diagnose that are total and free testosterone and DHEA. And supplements would be spearmint tea. And then medications are usually a traditional provider is giving you a birth control pill for this. Testosterone deficiency, this I see very commonly, very commonly, almost as common as low progesterone in women who are experiencing chronic stress.
Mm.
You get fatigue, low libido, reduced muscle mass, and depression. I'm seeing a lot of this. So again, you're checking the same total and free testosterone, and then SHBG, which is sex hormone binding globulin. You want to make sure you're asking for that because that tells us where in the pathway testosterone is not being made. So is it a liver problem? Is it PCOS? Is it something else? And then supplements for that would be zinc, DHEA, or just testosterone replacement therapy. There's synthetic versions of this and non-synthetic, if you wanted to be on hormone replacement therapy. All right, I don't think we have any males here, but just in case, I think it's good to know that males also suffer with, it's not menopause, but we call it andropause. So around, it's happening, I see it now in 30s to 40s. Men are just not making testosterone in the way that they used to because of stress. And what that leads to mostly is fatigue and depression. These are the guys who come to see me who are depressed. And they are gaining weight and they don't realize why they're gaining weight because nothing's changed in their diet. And then the more weight that they gain, the more estrogen they're going to produce, which diminishes their testosterone. So estrogen dominance and testosterone deficiency go hand in hand. And so men who are feeling this way really need to have both checked. So total and free testosterone, SHBG, LH and FSH, and then their estradiol as well. And there's lots of things that can be done for this. One of the best ways, the most effective, is testosterone replacement therapy, synthetic or non-synthetic, but you can also have supplements that help with this as well. Okay, the last one, blood sugar, so insulin resistance. So really what I'm talking about here is diabetes and pre-diabetes. And it sneaks up on us faster than we realize. But the key is if you get your labs checked and you get something called HbA1c checked, and it's in the pre-diabetes range, this is a perfect place because you can reverse this. Through diet changes and lifestyle changes, you can bring this back so you're not getting to diabetes. It's harder to reverse or reduce this number once you get to the diabetes range. So high sugar diet, being sedentary, genetics unfortunately plays a role here, and then obesity will lead to diabetes. But here are some supplements you can take, and then the medications that are recommended are metformin or GLP-1 agonists, which we hear a lot right now, like Ozempic. Okay, that was all of the hormone stuff. That's the heaviest part. Any questions about any of that?
So on the wheel of health, we've done diet and hormones so far, is that right?
We have done diet,
Stress.
stress, hormones, yep. And the rest are gonna be fast.
I'm gonna go get lunch ready, so I'll be right back.
Sure,
Okay,
sure.
okay.
Okay, genetics. So, even though we might have a predisposition to something, so say we have heart disease that runs in our family, so we would be predisposed to this, there are still many things you can do to prevent. It doesn't mean you're necessarily going to have it, but the cleaner your lifestyle is by following these sorts of tips, the more you can reduce the risk of those things happening. And that's really all I want to say about genetics, because a lot of it still is in our control, and I want people to understand that just because mom and dad have something doesn't mean you're gonna have it. Okay, this is the therapeutic order that naturopathic physicians follow. And the reason I want to talk about this is because my goal with all of these presentations really is to make you feel empowered and give you the education so that you know how you can advocate for yourself to your providers. And please know that there are many things that can be done to establish the foundation for health, including all of the tips in this presentation, before we have to go to medications or surgeries and procedures. So just always know that if you're seeing your provider and they say, oh, here's your labs are showing that you are pre-diabetic, so we're metformin, let's start you on metformin. And it doesn't have to be that. So knowing that there are other things that can be done before we jump to these high force interventions, higher at the order, it's important. Okay, now I want to talk about medications versus supplements. And I really want to emphasize that one is not better than the other. I know our preference is to be more natural with supplements, but supplements can have side effects just like medications can. And medications can be life-saving, where supplements usually are not. Supplements usually do not work as quickly as medications. So that's really the takeaway for this slide, is just know that one is not better than the other. They're both important. Okay, exercise. We all know that exercise is beneficial, but people often ask me what is the best type of exercise, and that is just the same as going back to that diet conversation, as there is no one type that is the best. It's more about what is your goal. If your goal is to reduce stress, then the mind-body practices like yoga, Tai Chi, and Pilates would be better. If your goal is to reduce the risk of heart disease from that maybe mom has, then aerobic exercise would be better. So this is just a reminder that there are different types of exercises, but really the takeaway here is that you want to aim for at least 30 minutes of moderate exercise. Most days of the week. So moderate exercise basically just means I'm working out and I'm having a little bit of a harder time talking to the person next to me. That would be moderate. If you can't say anything to the person next to you because you're huffing and puffing so much, that would be a high intensity. And I always recommend to avoid that because that's harder on your adrenal glands. Okay, toxins. This is a big topic here. One of the things, like I said in the beginning of this presentation, when I start my patients on these simple but really effective tips, the biggest impact on their health is really in the reducing the toxins in their environment. But this is kind of the hardest one because it really is a lifestyle change that you're making for the rest of your life usually. The biggest one is this guy right here. This is the biggest culprit. The plug-in air fresheners, the like Glade, I don't know what you call them, air fresheners, I guess. They have what we were discussing before, the endocrine disrupting chemicals, EDCs. Most of these toxin exposures are hurting your endocrine system, so the system that creates your hormones, and then they're also carcinogens as well. I know that we hear a lot about plastics. Yeah, plastics is a big one as well. These are hurting our endocrine system. So, you know, Tupperware like this, really, if you're making food and you're meal prepping and you have anything that's hot and you're putting it into a container to save for later, it should never be plastic. It should be glass or stainless steel or ceramic, but never plastic. The second that you heat up plastic, it is leaching chemicals straight into the food. And that goes for reheating. So if you put cold food in there, okay, that's fine. Don't reheat it in the microwave in your plastic. I put this image to remind you that there are chemicals in our skincare and personal body products as well. So our lotions, our shampoos. Yuka's a great app again for that. You can scan your skincare products and it'll tell you how clean it is. And then, of course, I think we know this, but environmental pollutants like smoke and mold, and then heavy metals or oil. It's best not to use oil when we're cooking. Okay, so how to reduce our toxin exposure. So this image right here is I think they're just called wet dry vacuums. So it's basically a vacuum that spits out water, so it mops your floor at the same time. The reason this is important is because when we're vacuuming or sweeping, we're picking up all of the stuff that's on our floor, so the dust and the pollutants that we brought in, we're just lifting it into the air to breathe in. We don't want that. So it's best to use a wet dry vacuum if you can. Of course, a humidifier or air purifier would be great as well. Avoiding pesticides in the home if you can. You can use essential oils. You could just diffuse them like citronella or eucalyptus, cedarwood, geranium, peppermint, or you can use these little, it's hard to tell in the image, but it's like a sticky box thing. I don't know if anyone's ever seen them, but basically it just has a sticky glue on the bottom that the insects crawl in and they stick and they're not in your home anymore. So this does not have any chemicals in it. So those would be a better alternative. Avoiding dry cleaning. Dry cleaning has a ton of chemicals in it. Exercising away from pollution. So if you like to be outside and exercise, do it at Camelback Mountain versus jogging down a busy road. Choose green household cleaners, or you can make your own out of just vinegar. Vinegar is a powerful cleaning agent. Doesn't smell the best, but it works. And this is the biggest one. I can't promote this enough. Homes should be a shoe-free zone because we're walking around and all of the pollutants and the pesticides outside. You know, even this beautiful courtyard, I don't know if they use pesticides, but maybe they do, and it's probably on the ground. So as you're walking through there, you don't want to bring that into your home. I have a little one, I have a 17-month-old at home who drops food on the floor all the time and then eats it right up. And so my home is a shoe-free zone for many reasons, but that's a big one.
What if we put them like in a bin, so they're kind of enclosed more?
The shoes?
Yeah,
Oh, yeah.
yeah,
Yeah, so right when you come in, you put your
yeah,
shoes
it's
there?
like a fabric bin, but,
Yeah, oh, that's great, as long as it's just not on the floor or bringing
Oh,
it into
okay.
the home. Mhm.
okay.
Okay, so things that you can do at home to reduce toxin exposure. Houseplants is a big one. The next slide will show all of the types of plants that purify which type of chemicals, so we'll get into that. Making sure to change your air filters every 1 to 3 months. This is hard to do, but if you could set a reminder in your calendar. Avoid artificial air fresheners, we talked about that. Instead, use a simmer pot. So this is my favorite thing to do when I'm having company. I'll just put a pot on the stove and I simmer water and I put cinnamon sticks and any citrus I have at home and cloves or any seeds. It's my favorite thing. And everyone walks in like, oh my gosh, what are you cooking? I'm not cooking anything, it's just my simmer pot. That's a great thing to do. If you are doing any construction on your home, reconstruction, then you want to opt for low VOC materials. A lot of the supplies now will be labeled as such, like at Lowe's or Home Depot, home improvement stores. So you want to find low VOC so that's not releasing a major component in non-low VOC materials is formaldehyde, which is really harmful for our bodies in general, but our endocrine system as well. On low pollution days and when it's not terribly hot, open windows for 5 to 10 minutes just to get airflow. It helps reduce mold as well. Again, to avoid mold growth, keep indoor humidity to 30 to 60%. If you can use your exhaust fans after showering, or you can use a dehumidifier in your home. Avoiding the parabens, phthalates, and aluminum and sulfates in your personal care products. So going back to the previous slide on that. And again, reducing plastic use, never heat plastic or put food in plastic containers. So these are the best air purifier plants. The Boston fern is a great one to have near, if you have an attached garage to your house, to have it near where you come in from the garage, because this one is great at eliminating exhaust fumes. And it's just pretty. These are all pretty. The peace lily filters out VOC. So again, that formaldehyde and all of the stuff from our electronics and adhesives, but be careful because it is poisonous for pets. Snake plant filters out carbon dioxide, benzene, and formaldehyde. Pothos filters out carbon monoxide, benzene, and formaldehyde. And the bamboo palm filters out solvents. And lastly, a rubber plant filters out formaldehyde. One thing to note about plants, however, they can grow mold in the soil. So you just always want to make sure that you have a lot of plants. It could do more harm than benefit if mold is growing in them. All right, we talked a little bit about why digestion matters. So just a reminder to have proper nutrient absorption, the gut-brain connection because of the neurotransmitters that are created there, the immune support, and of course, waste removal. So how to support digestion? Chewing your food thoroughly is basically like mindful eating, what we were talking about. Staying hydrated, eating fiber-rich foods, incorporating probiotics, avoid overeating. And a good one here is eating bitter foods before your main meal. So that would be like dandelion greens or Brussels sprouts, arugula. So like there's a reason why we're usually served salad before our main meal. It helps to stimulate digestion. So it produces the hydrochloric acid to better digest our foods. And then avoid triggering foods or food sensitivities. If you're able to have those tested and you know what your food sensitivities are, it's best to avoid those. So we'll get into that. So there's a difference between food allergies and food sensitivities. Food allergies are something that create an immune response, like anaphylactic reaction where your throat closes up or you start swelling. That's different than a food sensitivity. So with a food allergy, you have to avoid those foods or you'll need your EpiPen usually. But with a food sensitivity, these are foods we don't even realize half the time that we are sensitive to, and they're causing not just digestive issues, but systemic issues as well. Bloating is a big one, and headaches. Those are the two that I see most commonly. So if you're experiencing any of these issues, there's actually a lot more. It's best to ask your provider to test your food sensitivities. And food sensitivities, most of the time, can be reversed after eliminating them for an amount of time, usually about 90 days. Then usually you can reintroduce them to your diet and you're not having an issue with them anymore. Having too many food sensitivities is what causes leaky gut.
How do you test for that?
It's a blood test.
Okay.
Okay, and then sleep hygiene. So with sleep, the biggest thing I want to talk about here is creating a wind down routine. And the biggest one for that is turning off screens at least an hour before bed. I know this is so hard, especially because we're caring for other people, and usually when we put them to bed, it's finally our turn to catch up on the news or whatever it may be. But that often leads to trouble sleeping. So I really like to encourage people to have this wind down period by turning off their screens. Addressing hormone imbalances. So in our course about sleep problems, I talk a lot about hormone imbalances that can cause issues with sleep. I would encourage you guys to join that course. So I go into more detail with all of these: lowering cortisol, balancing blood sugar, supporting progesterone and serotonin, and boosting your melatonin. And then here are some vitamins and medications that can help with your sleep. Some of these I think we know, like melatonin we associate with sleep, but magnesium glycinate is the best magnesium. There's multiple forms of magnesium, so you want to make sure you're taking the right one. Excuse me, but magnesium glycinate is the best for sleep and just relaxation and as a whole. L-theanine is also a great anxiety reducing supplement. L-theanine can be used before bed to help if your sleep issues come from racing thoughts or just feeling a lot of anxiety. L-theanine can help with that. And L-theanine can be taken during the day too if you're experiencing daytime anxiety. And then here are some prescriptions that you can ask your providers about. Sorry, this is covering it. So Ambien, Lunesta, Rosarum, Trazodone, or Mirtazapine. All right, and then here are some resources if you want to read about some more stuff. Here's my shameless plug of my offerings for Mindful Medicine Academy. So I offer online health courses, and then I offer corporate wellness programs. So I deliver presentations like this to corporations and organizations if you're interested. Thank you. Oh,
that's her
time.
timing.
Joining us, everyone.
That was awesome. That was a lot of information.
It
I feel like my
was.
brain is gonna
I'm
explode.
sorry.
Thank you so much. I did have 2 questions if I can, because you were in the middle of the flow, so I didn't want to keep disrupting you. Oh no, where did it go? There's my question. I think one of them was, are there foods that naturally help to lower cortisol? Because I know we're all kind of amped up with our cortisol levels.
That's hard to answer because it goes back to food sensitivities.
Okay.
So think about broccoli. We all kind of associate broccoli as being a health food, right? But if you have a food sensitivity to it and you're unaware of that, that will increase your cortisol because your body's in fight or flight mode because you've ingested it. So, so yes and no.
Okay.
I would say the safest thing for me to say right now is anything that has a lot of vitamin C in it is going to be helpful for your adrenal glands.
Okay, that's awesome. Vitamin C.
Vitamin C.
Okay, Jesus, like what? Brain fog. What did she just say? Vitamin C. Okay, awesome. Thank you. Do you guys have any other questions?
I have a question about consuming foods that are high in the vitamins and nutrients that we need versus supplementing. Like, when do you know you're not getting enough from your diet that you need to seek out like the magnesium supplement or something like that?
I love that question. So ideally, in an ideal world, we wouldn't need to take any supplements. We would be getting all of our nutrients. It's more a matter of what's realistic for you. Okay, iodine is a perfect example. We find a lot of that in like seaweed. I don't like the types of foods that iodine's found in, and I use pink salt at home. So I know personally, I'm not going to be getting enough iodine from my diet, so I do need to supplement that. If there's something in particular that you're that you're focusing on, so let's say, neurological health or decreasing inflammation, and I really want to bring in more omega-3s in my life. Maybe I'm having a lot of knee pain and I want that anti-inflammatory effect. I'm gonna eat a lot of those foods, so like salmon or fatty fish, and I'm gonna take the supplement.
Okay.
That makes sense?
Mhm,
How do
yeah.
you know which supplements are good? Cause like some of them don't actually get absorbed in your body, you just end up peeing them out. So like, how do you know which ones are worth your money?
Yeah, that's a great question.
Like, will yoga help with that?
No, Yuka does not. Um, the best way I can answer that is to get them from your provider. If your provider is sending you to Amazon for your supplements, no.
Okay,
A lot of supplements that you find on Amazon are rebranded. So people are getting them as something else and they're rebranding them as the popular known healthy brand, right? Nordic Naturals is a very good brand for fish oil. You cannot buy those from Amazon because those are actually not Nordic Naturals.
how interesting.
Yeah, and I
Okay.
don't know that there's any way that you would know that other than getting them from a respected source.
Yeah.
If you have any functional medicine practitioners or naturopaths that carry their own medicinary, so their own like pharmacy, getting them from there.
Yeah.
The college that's here, Sonoran University, they have their own medicinary, so you can go
That's good.
there to purchase them. Whole Foods and Sprouts and I would say natural grocers over Sprouts and Whole Foods. I trust there's.
You do?
Mhm.
Okay,
Yeah.
okay. That's good, because I always am wondering, like, how do you tell? Cause like you said, everybody kind of repackages things.
Mhm. Just know Amazon.
Easy way to
I
go.
know this is-
Okay, so Stacy asked, can we order a food sensitivity kit online, or is it only doctors that can order those kits?
Another great question. I see those kits. I think I saw them at Target recently. Those kits that you can do yourself where it's just a drop of blood and then you can send it in. I can't speak to the efficacy of those. I truly believe you need an entire vial of blood to test your food sensitivities because the one I order is testing either 184 or 204 foods. And I just don't know that a single drop of blood can test that many. So personally, my opinion is it should be ordered by a provider, although I believe there are some companies online that will send you the kit. You just have to find a phlebotomist that will draw the vial for you, and then you can send.
I don't even know if I eat that many different kinds of foods. That's amazing. Okay.
It's seasonings as well that's included on there. A lot of people are allergic to pepper and garlic.
Oh.
Unfortunately.
That would suck, yeah.
How often do you recommend doing food sensitivity testing? Like the last time I did it was 10 years ago. I feel like everything has changed so much over that time and what I eat and how it makes me feel.
Definitely.
Okay.
Especially if you've had like children probably within that
Right,
time,
right.
and hormones.
It's really based on your budget. Personally, I do it every 6 months.
Okay.
Wow.
It changes that often?
Mhm.
Wow,
Wow.
I would not have thought that.
Yeah,
Okay.
but they are kind of costly. They're $200 to $300.
What's causing it to change that much in 6 months? Just environmental factors or the?
Environmental factors, if you're eating too much of the same food too commonly.
Mhm.
So broccoli is a great example. In med school, I got on this kick of like eating broccoli and hummus during class. I'm sure everybody hated me, it smelled gross. But I became sensitive to it. But I was like, how, this is a healthy food. Why am I all of a sudden feeling terrible? And it's because I was eating too much of it. So you really need to be rotating your foods. can't eat the same thing all the time.
Sucks for us autistic people. They're like, things that we eat all the time.
Right?
Okay.
Or even just to make it easy,
Interesting.
you know?
Yeah.
I've
Get
been
into like
thinking
your
of
habits.
Works, but you
Yeah.
can't keep doing it.
Mhm.
Fascinating. Very cool. Okay, any other questions online? We got Stacy's, Monique, I think you're still there. Let me know if you have any questions. You guys have any questions or we? Good. All right. Well, thank you so much. This was awesome. I'm excited for the whole series. So thank you.
Yeah, I'd love to have you all join for any of the other courses or all of them. I won't go as quickly in the others. I was covering a lot today, so.
Mhm.
There's a lot of good stuff.
Yeah,
Yeah,
I like
cool.
it.
Good.
Awesome. Well, thank you.
Yeah, good.
Very cool. I'll go ahead. We can end the chat. You guys, I have lunch set up, so feel free to grab stuff. We can eat in here, or it's really nice outside. We can grab a table outside and eat, whatever you guys want to do.
Some vitamin D.
Right? Get some vitamin D. It's so beautiful out. Thank you guys online who showed up. We'll see you guys later.